From CareCredit, it's Care Experts, a podcast where we dive deep into the health and pet care industry with the professionals that make it happen. I'm Antonio Diaz, and this is Logan. This episode is brought to you in partnership with Banfield Pet Hospital, quality veterinary care and pet wellness. The holiday season is a joyful time, but it also comes with unique risks for our pets. From tempting treats to festive decorations, there are plenty of hazards that can quickly turn a celebration into an emergency. Today, we're talking about how to keep your pet safe during the festive frenzy. We're joined by Dr. Taneeka Bautista, a veterinarian and medical director at Banfield Pet Hospital. Dr. Bautista is passionate about pet wellness and helping pet owners navigate common health risks, especially during busy times like the holidays. She's here to share tips on pet-proofing your home, recognizing dangers, and acting fast if an emergency happens. Dr. Bautista, I'm so happy to have you here. Before we jump into holiday hazards for pets, I would love to hear more about what brought you into veterinary medicine and kind of your journey to where you are now.
Sure. Thank you. So I grew up wanting to become a veterinarian.
Okay.
That is a common story amongst veterinarians. As a child, I had a lot of pets, primarily cats, and I got to experience them growing up in different life stages, having kittens, and I got to help raise them, name them, take care of them, all of those fun things, and including bringing them to the veterinarian as well. I think that really helped me to understand what veterinary medicine is all about. The veterinarian that I would actually go to allowed me and invited me to come into the back of the hospital and see things.
No way, that's amazing.
Right. So it was a unique opportunity. And it was an aspiration for my entire life.
I love that.
Something that I wanted to work towards. So I went to my undergraduate school and I went to veterinary school at the University of Wisconsin-Madison to become a veterinarian. And I've loved it ever since. So I'm so glad that I pursued that.
Yeah, I actually had someone say to me many years ago before I got into training myself that if you think back about something that you were really passionate about as a child, that's usually the best path for you to go when you had like no restrictions and your imagination was able to take hold and, think about the things that you wanted to do. So for me, I know that speaks very true. And I totally resonate with your story because ever since I was a kid, I knew that I loved dogs and wanted to do something with dogs. And it wasn't until I became an adult that I actually kind of reflected back on that early passion and then kind of led me to where I am now. So
Yeah.
I love it. So with the holidays here, let's talk about some common holiday hazards that you see with pets.
One of the very common issues that we almost anticipate, unfortunately, is having a pet get sick because they ate something they shouldn't have eaten during the holidays.
I can imagine.
Right. So during the holiday season, there are foods that are new and unique that we are eating in our house. We might not eat throughout the year. There are other things that we bring into the house, including decorations, ornaments,
Yep.
lights, etc. That can also become a hazard for pets. There are also people that sometimes come and visit. So all of those things can really change the environment, and some of it can increase risk for pets. With regards to food, sometimes people feed their pet something that they really shouldn't be eating, and so that can make them pretty sick sometimes, and so that's not uncommon to see during the holidays.
Yeah. What are common foods that people are giving their pets? Let's just not give them.
It's really recommended that we don't give our pets anything that is
Fair enough.
people food.
Yeah.
Because every pet might have a different kind of tolerance for that. And it's really more safe to feed our pets their pet food, what they've been eating all along. I know that it's tempting, but that's the safest thing to do. Our food is higher in fat content, sugar, salt as well. So that's not good for them either. But in addition to that, there are some foods that are more toxic too,
Yep.
directly toxic, and can cause health conditions that we would need to treat them for. So onions, garlic, chocolate,
Yep.
grapes. Those are just a few. Sugar-free food is even bad because it contains xylitol, which can be very toxic
Yes.
to pets, and caffeine foods too. So all of those things, it's really hard sometimes to figure out what exactly is in the dish that we're eating sometimes. And so there's a lot of risk to that. So it's really safer to just let them eat their own food.
Gotcha. Now, my thought immediately goes to if somebody's hearing this, they go, okay, well, I'm not going to give my dog anything like that, but I'll give them some turkey bones around Thanksgiving, or like a ham bone or something like that. Do you see a lot of pets coming in with issues consuming cooked bones?
Yes. Cooked bones is not recommended to give to your pet as well.
Yep.
Sometimes they can swallow a large chunk of a bone, and it can actually lead to an obstructive process in the GI tract. So it
Okay.
can get stuck, and that would lead to surgery that might need to
Oh,
occur.
man.
It can become an emergency as well.
Okay.
Some bones can actually break as well when they're cooked. They're more likely to kind of shatter and become spicule,
Mm-hmm.
sharp,
Yep.
and that can actually lead to additionally GI upset and perforation potentially.
Wow.
And so it can be very serious. Yeah. So it's not recommended to give that to pets either.
Copy. And then as far as decorations, what are some common issues you see with regard to decorations and pets either eating them or getting into them or maybe becoming injured by them?
Yes, similarly, unfortunately, pets sometimes will eat decorations that, like for example, tinsel. I
Mm.
have seen a cat with a belly full of tinsel that would not move forward in their GI tract. So that can lead to obstructions. Other decorations that we sometimes have in the house, including lights, which are electric and are plugged
Yeah.
in. And sometimes pets will chew on the cords and they can become electrocuted.
Wow.
Also, there are ornaments that can be placed throughout the house, glass and or metal that can similarly be sharp and cause a lot of concern as well if a pet
Okay.
does ingest that. So, it's kind
Man.
of all of the above.
So if someone's like, look, I'm not going to not decorate my house, do you have any recommendations in terms of maybe some things that they can omit from their decorations, or better ways to keep pets away from them?
Keeping pets supervised is really important and good. When it comes to omitting things, I think it's important for people to be able to do what they would like as far as decorations go. But having, for example, a Christmas gift that has food in it will bring a lot of attention to that
Yeah.
item. And so the pet will probably dig through that and may ingest something in the process
Yep.
that they shouldn't have. That's what comes to top of mind for
Yeah.
me.
I
So,
was thinking like, for example, let's not put the tinsel on the tree, because the cat has a tendency to go for it.
yes.
So you can still have the decoration, but not necessarily utilize something like tinsel.
Right.
From my experience, I deal with a lot of this too around the holidays, where people have dogs that are getting into things, and just really people are trying to navigate through that. So I typically recommend teaching the dog either to be crate trained or to go to a bed, kind of like Logan is right now, and just learn that that's a safe and comfortable place for them to be while they're, let's say, decorating the tree or putting things together around the house, to keep the dog
Mm-hmm.
out of it, because it can be hard for people to supervise while they're still trying to manage, I would say, all the nuances and the things that are involved with like the holiday season, right?
Yes, I agree. Having a safe space for your pet to be that is a little bit more secluded and
Mm-hmm.
doesn't have all of those things, that's a great point. Having a crate, maybe a baby gate as well to
Yes.
kind of
Yep.
block off. So some of the things that we do to childproof our home, we can similarly do for pet proofing
Yes.
to
Absolutely.
keep them safe. So just keeping them away from those things is really helpful too. And when it comes to the tree, as you mentioned, cats will sometimes climb it. That can be a hazard too because the tree can fall over. And the recommendation is that we set up the tree first, let it sit for a few days. If there's a curious pet in the house, they can kind of just
Get
get
over
used to
it.
it being
Yeah.
there before the decorations are added to the
Okay.
tree.
That's smart.
And then they're maybe hopefully less interested at that time. Also, anchoring the tree, anchor it to the wall, anchor it to the ceiling.
That's a
Um,
great idea.
will make it less likely that it'll topple over. Cats do like Christmas trees. It's part of their instinct to climb trees. So keeping them away from it can be tricky, but doing those things can make it less likely. And as you said, no tinsel.
Gotcha. Do you see a lot of dogs coming in, or even cats, with higher levels of anxiety and or stress around the holiday season? Do you think the change of routine creates that? Do you maybe see yourself recommending some modalities to deal with those issues more?
There are a lot of reasons that pets can be stressed with relation to that. So even just having strangers in the house.
Yes.
Sometimes people come in and our pets don't know, and they might not be interested in meeting someone new or not at the pace that maybe they are expected to.
Yep.
So they might go hide, for example, giving them the ability to do that, to have a safe space that they can turn to. Um, and if they become curious, introducing them to that person gradually is really helpful. Some other things that can be stressful include, for example, outside of the house, um, fireworks during a holiday
Yep.
season, whether it's New Year's or even, 4th of July, other holidays can be for some pets, very stressful and create some anxiety for them. So it's recommended that if we know that that's the case, that we're helping them with that by having some additional noise in the house, maybe the TV or music playing, closing the curtains, and giving them, again, a safe space that they can turn to if they need. If those things don't work, the veterinarian can also make some additional recommendations. Sometimes there's medication that we would recommend to help to settle the pet as well.
And would that be more of like a proactive approach? If somebody already kind of knew that they are like, it's going to be hard for me to handle it, let's get them on something to calm them
Right.
down a little bit more. Gotcha.
Yes.
Okay.
Sometimes people know my pet does not like this, and so they will come in proactively and get the medication and guidance from the veterinarian before those events happen.
Yeah. And I want to touch too on what you said earlier about, having guests come over. I see that a lot in my line of work where pets are stressed because they have people in the house, but it's not just the act of the person being in the house. I think a lot of times it's actually the pet lovers, the dog lovers and the cat lovers that come over to people's homes, and they're trying to force affection on pets and dogs, or cats and dogs rather. And yeah, I always like tell my clients to make sure that you advocate for your pets. If people are dog lovers, that's fine, but your dog may not want affection or want somebody hovering over them. So be mindful of allowing that pet to have their space and making sure that you're doing a good job advocating for them, because I see that a lot. And then it always ends up falling back on the dog because they're the ones that quote act aggressively. But the reality is that they're just being defensive, and it's not really their fault. It's like you're just bothering them at that point. So I think it's important for people to understand that and like lay off, How would you recommend setting up like a safe zone? Do you have any specific recommendations? I know you talked about a separate room. So what other recommendations would you have for that?
Definitely a separate room is great, especially if the pet is used to being in that area. We just need to make sure that they have all of the things that they need: food, water, a way to go to the restroom. So for cats, of course, a litter box.
Yep.
For dogs, it's good to either have already taken care of that before placing them in there, or be prepared to follow up and take them out for walks if they need to. Or if there's a ability to actually get outside, if they can have like a doggy door, depending on where that location is. Also, being outside's okay too. Sometimes pets spend a lot of their time outside, and maybe all the activity is happening in the house, and so they can be in their safe space by being outside.
Gotcha. As far as food goes, do you have any recommendations for safe treats, or maybe a way that people could incorporate some of those holiday foods in a dog version or a cat version for their pets?
It's such a common question.
Because I know people want to like give their dog stuff. Personally, when I talk about that, I always try to give people more like single ingredient food options and things that aren't going to be filled with hidden ingredients and potential issues, toxic foods like xylitol and things like that. Even when people give peanut butter, I always make sure that they understand that some peanut butter has xylitol in it. But yeah, just curious if you have any recommendations from your end of specific treats or ways that people can incorporate those holiday foods.
So some diets actually have a treat version of that same diet.
Okay.
And sometimes I think the aspiration or desire to give our pet treats, it's more for us than it
Agreed.
is for our pet.
Yeah.
And so it's okay to, if that same diet has a treat version, then that might be okay. But I definitely recommend speaking with the veterinarian, because there are food allergies and things like that. It's so unique. Each pet has its own kind of individual probably recommendation that would be made.
Yeah.
It's really tricky to be able to say, you can give your pet this particular thing, because I would, hate for someone to do that, and then it creates a concern for them, you know? So
Yeah, I can understand.
definitely it's so tricky, and that's why the pet food is the safest way to go. Otherwise, recommendation from the veterinarian.
Okay. And as far as allowing our pets to be more involved with the holiday celebration, do you have any recommendations or tips on how to involve pets more that want to be involved? I'd like to clarify that.
Yeah, I think it's great to be able, if they want to be
Yep.
involved, we can find a safe way to do that. It's got to be supervised, of course.
Mm-hmm.
It's also, if there are guests coming over to the house, letting them know also what that same expectation is,
Yes.
so that we're kind of all on the same page. We're going to have our pet with us, and what to and not to provide to them, and just kind of considering how they feel about the company being there and all of the activity. Sometimes pets can get a little bit nervous, and we want to make sure that they're safe and that our guests are safe too. But they can definitely participate. Some pets are more would prefer to be in that setting with us and to be able to be around during the activity. We just want to do it safely.
Good. I love that. Is a dog throwing up an issue that somebody should be concerned with right away, or or should it be looked at like if it's something that's happened quite a few times throughout the day, or maybe a few days, then they should bring him to the vet, or what is your take on that?
Okay. Well, I'll say that vomiting is not normal for either pet.
Okay.
Depending on what is seen in the vomit can sometimes be an important kind of clue as to the importance or the urgency, and the symptoms that go along with that too, lethargy, any other symptoms with the appetite. If it's a one-time occurrence, depending on what was included in
Mm-hmm.
that, what came out of that pet's stomach. Sometimes people are comfortable evaluating that a little bit,
Yeah.
and that could actually provide some really important clues for the veterinarian. Or to your point, if it's frequent, if it's happening more than once in a moment, more than once in an hour, more than once in a day, that can also be a sign that something is pretty significant and the pet may need to see the veterinarian.
Okay.
So, yeah, it's helpful when people actually take a little bit further look. Sometimes people take a photo of it too. I know that not everybody wants to kind of get involved in
Yeah.
that. So maybe a photo, and also knowing like what the pet was exposed to prior to that.
Okay. And what recommendations would you give to somebody to help prepare for a potential emergency anytime, but even specifically during the holidays?
Kind of know ahead what to avoid as best as possible, and to do our best with managing that.
Okay.
Educating the entire family so that everyone's on the same page. Because sometimes one person kind of takes ownership of what's going on with the pet,
Yeah.
who's feeding it, how much, and etc. And the whole family really should know what that looks like, the items that are in the environment, making sure that we're not exposing our pet accidentally to something that could be hazardous or toxic to them, and then what to do. Having an emergency, the local emergency phone number is really helpful too, and knowing where that is just in case. So if something happens, we spend less time trying to search for information that we might already be able to use, and hop into the car and go if we need to. So just a few things that come to mind there.
Okay. How can Banfield's virtual pet care help determine if it's an emergency that they need to bring to their vet or something that they can wait on?
Yeah, so virtual pet care is fantastic because it allows people to have a consultation in a telemedicine type
Mm-hmm.
format, and they don't necessarily need to get into the car and come down and have that exam. Depending on where the veterinarian is located, that virtual pet care can vary as far as how the visits occur. Because
Okay.
in California, for example, it always will need to be a follow up. We need to have a veterinary client patient relationship already established.
I see.
So it wouldn't be for new concerns, for
Okay.
example,
Or like a new client.
or new clients.
Yep.
Exactly. So those visits do need to happen in person in the hospital with the pet. Um, But we also have something called Pet Chat as well, which is a chat. It's a text chat option, and it is included in our optimal wellness plans at Banfield
Okay.
Pet Hospital and allows clients to ask questions on the phone
That's
to a
awesome.
veterinary professional. Yeah, so they can use that as a platform as well. But similarly, we've already built a relationship with that client as well. So again, if it's a new pet and a new vet, they would still need to come in to have that initial consultation.
We're going to jump into our Ask Me Anything section of the show.
Okay.
We have a couple questions here that we have from our viewers. So I'll just kind of throw them at you and you can knock them out. All right. My dog loves sitting under the table at Thanksgiving and catching all the scraps. Is there a food we need to tell our family not to give him or to be extra careful with? Turkey, mashed potatoes, yams, stuffing, pumpkin pie. Inevitably, something ends up on the floor.
Yeah, sometimes our pets are little vacuums and they want to try to
They
clean
know.
up everything. And they know if I sit next to this person, something's going to fall. Sometimes it's a high chair.
Yep. I was going to say the baby
The
for sure.
baby. Yes. It's just really hard to predict how a pet would respond to certain things that we eat. And a lot of our food is not safe for pets. So it's not recommended that we feed our food
Yeah.
during the holidays. They really should continue to eat their pet food that we know is safe for them.
Yeah, I agree. And one thing I would like to add to that too, from my perspective, oftentimes when dogs are crowding around a table, there can be issues of resource guarding. And that's amongst other dogs in the house and also family members or guests that may drop food and then reach for the food at the same time that the dog's going for it. So I always tell people during dinner time, make a habit and a routine of putting the dog on a bed, on place, or maybe in a kennel or behind a baby gate and just kind of managing them better. This way you can create healthy habits and you can eat in peace, so to speak. This way the dog learns if they wait on their bed patiently, that they'll be rewarded for that and not necessarily rewarded for crowding and scavenging around the floor. So
I appreciate that. And it's really important to make sure we know what foods not to
yes,
ever feed pets
agreed.
too. So grapes and raisins can be toxic, garlic, onions, and foods within the onion family.
Yeah.
Sugar-free food is really dangerous for pets. I think I mentioned chocolate
Yep.
as well. So knowing what those things are that are commonly in our household that should never make it to your pet's mouth also is really
Yeah.
important to know.
And I want to even add to that. If I always say to my clients, if you're really wanting to give your dog something, give them a high value treat that they can have, like their own dog food, dog treat or whatever, and put it in a Kong or some item that they have to work at it and then give it to them on their bed. So while you're eating dinner, they're also occupied and having something as well. So that way they're not feeling left out of that whole process, especially if you're dealing with a dog that is used to being around the table, kind of giving them a little something to say, hey, I know you want to be over here, but be over there. We got something nice for you. You can enjoy it there. All right, next question. I'm traveling with my dog Wrigley to my grandparents' house for the holidays. What should I pack for my pet in an emergency just in case?
It's always important to make sure that our pets have food and water with them, any medication that they've already been on.
Yep.
And also, if they have a history of some kind of maybe medical concern that has developed, such as an allergy, having the proactive plan on how to address that as well. So, in addition to that, when traveling, it's really important to make sure we have all of our documents prepared.
That's a good one.
Sometimes pets are going on a plane, a train, crossing the border of one state to the next, and there's paperwork that's required, including a health certificate, vaccinations, things like that. So just planning ahead to make sure that your trip is able to go from start to finish without any issues.
Yeah, I agree. I love that. Thank you. Dr. Bautista, thank you so much for your time. Really enjoyed the conversation.
Me too. Thank you so much.
You're welcome.
Appreciate it.
Thanks again to Dr. Bautista for joining us on Care Experts. We learned so much about protecting our pets during the holidays and how to enjoy the season safely together. Thanks to everyone tuning in. This episode was brought to you in partnership with Banfield Pet Hospital. Hey everybody, If you like what you've heard, give us a 5-star rating and don't forget to subscribe and follow on your favorite podcast platform. New episodes drop every Wednesday, so don't miss it.
For information and entertainment purposes only, not to be construed as medical advice. Consult your provider. The CareCredit credit card is subject to credit approval. The information, opinions, and recommendations expressed in the episode are for informational purposes only. Information has been obtained from sources generally believed to be reliable. However, because of the possibility of human or mechanical error by our sources or any other, Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, does not provide any warranty as to the accuracy, adequacy, or completeness of any information for its intended purpose, or any results obtained from the use of such information. All statements and opinions are the sole opinions of the doctor being interviewed. The data presented in the episode was current as of publication. Please consult with your individual advisors with respect to any information presented. All products, services, and company names are the trademarks of their original owners. The use of any trade name or trademark is for identification and reference only, and does not imply any endorsement, sponsorship, or affiliation by or with the trademark holder of their brand.